Hello, everybody. Welcome to our show, Wellbeing Makes Sense.
My name is Claude. This is Camille. What's her name? Ezra.
And my name is Serge. Welcome, and we are happy that you join us and our family as we discuss a very important issue. That is,
What are we talking about today?
Daddies!
We're talking about
Daddies! Kidneys! Daddies!
kidneys.
Kidneys and daddies!
Yep.
so
Awesome!
stay
Mommy.
tuned. That's going to be a very interesting show. We're going to start by defining the kidneys, explaining to you what they are and what they do in the body. So, what can you tell us about the kidneys?
All right. Can you go? So kidneys are organs that is in our back, our flank area right here. So we're born with two of them. Some people are born with one. But majority of population we have two kidneys in our back, in our flank area. And what it does is basically filters the blood, gets rid of certain toxins, certain medications, etc. And we urinate the rest out into it comes from the two kidneys. We have the ureters, and then it comes together into the bladder, which is in the front, and then from the bladder to the urethra, and then out to the world. So this whole system is called your urological system. And obviously things can go wrong with kidneys, and our major topic is hematuria.
Yes. So you got to understand that the kidneys are very, very important, and you need to be careful with them. You need to take care of them. And as we are addressing one of the many issues that you can have with your kidneys, I hope that you are taking notes. So we are talking about hematuria. So what is hematuria?
So let's break it down, right? Hema, blood, urea, urine. So blood in your urine.
Do you think that's okay to have blood in your urine? I know many of you have seen blood in your urine before.
Do you want blood in your urine?
No, not a good thing at all. And there are many different causes. First, we got to say that there are two types of hematuria. There's the micro and the macro, or called gross hematuria. So the micro is when you have blood in your urine, but the blood is the quantity is so small that you can't see it. Most of the time, it got detected when you go for a checkup, or when you go to the ER. They run some labs, and the lab will test your urine. And among the things that they test in your urine, they test for blood. So this is how they find it. And we'll go to more detail about it later. The gross hematuria is when you can see it. When you go to the bathroom, you're peeing and you see the color. You see the red color.
It would look something like this. Some of them even thicker. Some can have clots. So this is an example of gross hematuria.
Let's talk a little bit about the causes. And so let's start with, which one you want to start with?
Well, the some most common causes, it can be a UTI, infection of the urinary tract system. It can be caused from the bacteria that is causing shedding of the mucosa, meaning the lining of the tract system itself. Okay. Others can be due to the most scariest part is cancer. You know, it can have bladder cancer, kidney cancer, can cause these things. Trauma can cause the hematuria. You know, what else?
Prostate cancer.
Yeah, cancer. Yeah.
Yeah. Also, we can have sickle cell anemia, and some medications like antibiotics, like anticoagulants, some chemo drugs can also change the color of your urine, make you have blood in your urine.
Kidney stones.
And kidney stones. So I think we covered the most important ones. But what's important for you to realize is that blood in your urine is a symptom. All right, it's not a disease itself; it's a symptom. So you need to figure out what caused this symptom, so that you can treat it. And the best way to do that is, of course, to call your doctor, and they can run some lab so that they can figure out exactly what's going on in your body. And this way they can administer the proper treatments. But let's look at a little bit at the risk factors for that. One of the risk factors is for men over 50. You know, because after men over 50 tend to have an enlarged prostate. So this can be a sign that your prostate is growing out of proportion. So you need to have your doctor check it out, and then they can talk about the proper treatment for you. What other risk factors do you have?
If you're an athlete and you're noticing that you have hematuria, it can be due to not drinking a lot of water, and also the muscle breakdown. This is very, very important that you need to get that checked out. If you're exercising so intense that you're noticing that you're having blood in your urine, it's brown, it's darker than usual, along with muscle aches, that means your muscle is being wasting, and those products can do severe damage to your kidneys. So be attentive, be vigilant, especially if you're an athlete.
Also for women, research shows that 50% of women will experience urinary tract infection in their lifetime. So you need to be very careful with that. So a UTI is very common in women. And the last one, probably, if you have a history of kidney stones, if you have a family history of kidney stones, so definitely this puts you at risk for hematuria. So, like we said, there are too many causes for hematuria, so we cannot address all of them. But we're going to give you some tip on a few of them, actually on 3 of them. Let's give you some tips on the urinary tract infection first. So,
so for UTIs, right? Mm-hmm. You want to drink a lot of water. You want to urinate as much as possible instead of leaving the urine in your bladder to settle. A lot of females, you want to, after having sexual intercourse, very important that you urinate just to clear the tract, because the urethra for the females is so short. So when you drink a lot of water, you want, for a good bladder or kidney health, you want to evaluate how much water you're drinking. Okay, so if you want to hold this. Okay, if your urine is this color and is dark, you can't see through it, that tells you that your body is lacking volume. Your body is lacking fluid. So you want a urine that is, can you bring it to the Can you bring it?
This little.
You see, the urine should be clear, even clearer than that. That means that you have adequate volume in your body. All right, you want to speak about enlarged prostate?
So basically, the prostate is one of the organs that help control the urethra, especially when doing pee, help control pee, and also doing sex. So so you need to try your best to have a healthy prostate. And one of the advices that we can give you is to maintain a proper weight. Maintain proper weight, exercise, eat healthy, reduce fat, and of course you can use one pumpkin seed. They found that in research that pumpkin seed is one of the things that help men with prostate issues to get it to a normal size. And the last thing that we want to touch on is kidney stones. So kidney stones are very common and very painful when you have them. So part of the things that you want to avoid is caffeine. Every product that have caffeine in them, your sodas and coffee itself, because these promote kidney stones. Processed foods, dairy products also promote kidney stones. So what are the things that we can eat?
Things that we can eat to avoid or to lessen our chance of kidney disease and kidney stones is, enriched plant diet. Everything that's rich in magnesium, potassium, sprouts, wheats, hydration is very important. Lemon in hot water. Again, the lemon is an alkalizing agent, so basically helping your getting a better pH balance to prevent any calcium growth in the kidney organs itself.
So these are the advices that we have for you for today. The kidneys are very important. You don't see them, but you don't want them to be damaged. So please take care of yourself, take care of your health. So and we'll see you next time.
All right, thank you again for checking us out again on Wellbeing Makes Sense. Remember to like, subscribe, and share, and thank you for your support.
Bye.